Okay, so this is an introduction to what we're going to be doing this week in terms of digestive anatomy. So splitting it into two labs, I would suggest starting with the microscope slides, and there's enough of them that you could probably have just a session on that, and then moving to the digestive anatomy models afterwards. So what I'm going to do is I'm going to show you the different slides and models that we have photos of, and then that should at least prepare you for what you're going to see in the lab itself. Okay? Alright, so this is the website, the Picasso website that I created with photos of the models and slides, etc. I believe you have the link for it. If you don't, just let me know. Alright, so we're going to start with the slides as well. I have the lab manager looking at the same time. Okay, so the first slide that you have is the salivary gland slide. And this one, there's two aspects about it. Very simply, two things they need to know. They need to know the Acini cells, and then they need to know the excretory duct. So when you look at the slide, it's going to be mostly like this. You're going to see these bubbles of material and these mucus secreting glands organized in these round Acini cells with the nuclei that you see out to the side there. So these round bubble-like structures are the Acini cells that secrete the saliva. The other thing that they'll need to find is an excretory duct, because these are a type of exocrine gland. They're going to have a duct leading up from them. Now what we're seeing here is, of course, a cross-section of the duct with like a stratified cuboidal epithelium lining it. So they'll need to look around the slide until they can actually see one of these ducts. And then you can see the saliva inside. This one's in cross-section. They may also see it in longitudinal section, but they're going to be looking for that thick wall of the duct. Okay? Now, it'll likely be zoomed up just like this so that you can see either the duct or the mucus acini. All right, next what we get to is the alimentary canal, and there are three sections of that. The stomach slide, the duodenum slide, and the ileum slide. The first thing you want to have an orient on is the fact that, of course, because these are all part of the muscular tube, these are going to be similar. Okay? And when they look at these, they're going to need to find the four layers of the alimentary canal in each one, which is basically the tunica mucosa, the submucosa, the tunica muscularis, which is down below that, and then the tunica serosa. Now, in most of the slides, what they're going to see is just the tunica mucosa, submucosa, muscularis. Serosa is a very, very thin layer on the outside, right, the serous membrane. So most of the time, they won't see that. So they need to find that in all three of the slides. But a key aspect to these slides, because they are so similar, is finding something that is something discriminable about them, to differentiate between them. And in the stomach slide, which is what we're looking at now, the key aspect that I have them find is basically the rugae. So the rugae are the folds of the mucosa inside of the stomach that allow it to expand when it's full with food, etc. Now these are very broad curves on the inner surface of the mucosa. Okay? And what we'll find when we get to the duodenum and the ileum is that they also have wrinkles, but not big, broad ones like this. They will have very kind of projected-looking wrinkles instead. So these nice, broad wrinkles that we see here are going to be the rugae. Okay? All right, so all this is tunica mucosa that you see here, with the broad waves of the rugae there. These little indentations that you see along here are the gastric pits. Okay? Now, within the stomach slide and within the tunica mucosa, there are two types of cells that they have to find, the parietal cells and the chief cells. Now, on the stomach slide, there are three sections of the stomach. One of those is actually stained well enough that you can find the chief cells and the parietal cells. Okay, so you've got to look through. I think it's the middle of the three sections. So you're going to be zooming down in this area and looking for the pink parietal cells or the darker purple chief cells. And you need to know what each of those secrete as well. So again, we've got the tunica mucosa here in the stomach with the rugae the gastric pits, and then we're going to have a zoomed up version of this where we can see the chief cells and the parietal cells as well. Now, with the 4 layers, mucosa, submucosa, muscularis, and serosa, there's also here a very thin, smooth muscle layer of the mucosa called the muscularis mucosae. Okay? This little thin muscular layer is part of the tunica mucosa, and it's not involved in actually moving food down the stomach or churning or whatever. It's a much smaller level activity than that. But they invariably get confused with this muscular layer here with the very thick muscular layer that's going to be just deep to the tunica mucosa that we see right here. Okay? So that's what that is here. So be aware of that. So we've got mucosa, dark purple layer. Submucosa usually has a lot of space in it, a lot of different types of tissues, including blood vessels, lymphatic vessels, etc. And then we have the tunica muscularis. Now, the tunica muscularis has 2 layers within it as well. Okay? It's got an inner circular layer and then an outer longitudinal layer. So let me see, I'm looking in the book. Let's see where they have that listed out. So the muscularis, of course, is also called the muscularis externa. I tend to call it the tunica muscularis. And of course, the stomach has the 3 layers instead of the 2. It's got an oblique layer in addition to the circular and the longitudinal. Okay, we can't see those here, but the circular and the longitudinal layers of the tunica muscularis will be necessary to find in these slides too. Okay, one second. Let me try to show you the parietal and the chief cells as well, so that we can see all the different aspects of what we need for the stomach, and then we can move on to other sections. Okay, so here is within the tunica mucosa of the stomach. So here we see the larger parietal cells, and then here we see the dark purple chief cells, smaller. Okay, so you need to be able to identify those as well. All right, so let's get back then. We finished up with the stomach. Now we'll get down to the duodenum. So now what we're seeing here is 3 of the layers. We're seeing the mucosa, dark purple, the submucosa, right, with blood vessels and a lot of space in there and other connective tissues. And here we can actually see the tunica muscularis, or the muscularis externa. Okay, so again, when we get to the intestine, now what we have are these finger-like projections sticking up that are called villi. So they're going to need to find villi, and villi are inherent to the intestine. So if they find villi, they know they're looking at intestine, so at least we have that separated out. But we still have either the duodenum or the ileum. So the question is, what's the identifying feature then with the duodenum? With the duodenum, there are duodenal glands that you see here within the submucosa that secrete an alkaline mucus. This is to neutralize the acidic chyme that's coming down from the stomach. So duodenal glands, also known as Brunner's glands, only found in the duodenum. So that's your key thing for them to find in the duodenum. Tell them they're looking at the duodenum. Okay. The other thing we can see in this slide, like we said, is the tunica muscularis, or the muscularis externa. We can see a border, like right here, where the fiber orientation changes. So this is the circular layer on the inside, and this is the longitudinal layer on the outside. Okay? Circular is always on the inside, longitudinal is always on the outside. You can see that there's a fiber arrangement as well. All right, so we move to ileum now. Ileum, same thing. We're going to see the finger-like projections like you see here. These are the villi, okay? But we also see these very sharp folds, circular folds that occur in the intestine as well. Now, these are in the duodenum or the ileum, but this one is just being shown in the ileum slide right now. But this right here is either called a circular fold or a ficus circularis. And you'll see it listed in the lab manual. And you'll also find this on a model as well. Okay, so there's a ficus circularis. Now, how do we tell this is the ileum? So we've got the mucosa, we've got the submucosa through here, and we can see just the first layer, the circular layer of the tunica muscularis. The key aspect to look for in the ileum is the Peyer's patch. Peyer's patch is a lymphoid nodule, lymphoid tissue that exists kind of at the border between the mucosa and the submucosa, and it's made up of all these dark purple dots, right? There's going to be white blood cells in there, etc. So the presence of a Peyer's patch is going to tell us that we're looking at the ileum as opposed to duodenum or stomach, okay? In fact, there's two ileum slides. One that just says ileum, another one that actually says Peyer's patch is on the slide. If they can't find a good Peyer's patch on the ileum slide, then put on the Peyer's patch slide as well. The Peyer's patch slide will actually have like 5 or 6 large Peyer's patches in a row, but it's more common to kind of just see one like this, and then maybe one down the way, etc. All right, so that's the ileum slide. Now, after we get through the ileometry canal, we actually have some of the accessory organs. So we've got the pancreas. Now, with the pancreas at this point, all we're going to be looking at is the digestive function. We're going to hit it again when we get to endocrine system, but right now we're looking at the digestive function only. The pancreas is an exocrine and an endocrine gland. We're focusing on the exocrine function. So when we look at the pancreas, we see a lot of these dark purple dots, and then every once in a while, it looks like somebody dropped bleach on the slide, right? These bleached out areas are the pancreatic islets. They have the alpha, the beta, the delta cells, etc., that are part of the endocrine system to secrete insulin and glucagon, somatostatin, etc. Okay? So the bleached out areas are the pancreatic islets. They're characteristic of the slide, make it easier to identify, but it's not the part of the slide that we're focusing on right now because those are endocrine in function. What we care about right now are all the purple cells everywhere else. Those are the ones that actually have the digestive function. These are the ones that put out the sodium bicarbonate, etc., the digestive enzymes. So these are pancreatic acini, or acini, technically, which are in digestive function, as opposed to, like you see here in the bleached out area, the pancreatic islets with the endocrine function. So this is a very simple slide. All they need to know is the pancreatic acid, okay, all these dark purple cells. Okay, so let me take a look at one other slide, though, that I usually show people as well, okay? Now, I include it in my classes. It's up to you whether you want to include it in your class or not. Find it here for you. Not listed in the lab manual, so that's what makes it a little bit dicey, if you will. It's the liver. So it's in all the slide boxes. Historically, I've taught it in my classes here in California. So again, it's up to you whether you want to teach it or not. It's a fairly simple slide. Has these very characteristic open spaces here, which are the central veins. Okay? So what they need to know on this slide, this is at 10x, right, for low power. It's easier if they zoom up, to the high power, okay? Because what we're going to see here is one individual organizational unit of the liver. It's called a liver lobule. So this whole thing right here is a liver lobule. It's all of these hepatocytes, right, liver cells, that are organized around this central vein. So a liver lobule is all that we're seeing right here. So they would need to know, what I usually have them know is liver lobule, central vein that we see here in the center, the hepatocytes, which are all the pink cells here, and then the spaces that we see in between are called sinusoids. So a lot of the digestive function for the liver, including making bile, etc., is occurring within these cells and in these sinusoids. Okay? So again, you can include this or not, it's in the book. But I just want to highlight that just in case you want to. Alright, so those are the slides. Like we were just talking about, there's a number of slides, and so it does take a bit of time for them to go through them all. The other thing I want to do in terms of anatomy then is look at the models as well, because there are a number of models. So when we look at the models, okay, they've got lists of structures that they need to know for the model. And in most cases what they have are bolded terms for the things that they have to know. But it depends on the model. Like the pancreas and spleen model, it's just a bolded term. The other model is actually everything that you see listed. Yeah, something they need to update in terms of the format of the lab manual. Notice that there's a number of structures that they have to find on the model that have an asterisk with them. Anything with an asterisk, they also have to find on the torso model. So we're really going to start using those torso models to highlight our systems as well. Okay, so this is one of our comprehensive 3D models. It shows all of the digestive tract. And so this is one of the main ones that they'll use to find all the different structures. So both accessory structures like teeth and the lips and the tongue, etc., as well as the esophagus, different parts of the stomach, including different areas like the fundus and the greater curvature and all that, different sections of the alimentary canal. Generally, I have them be able to identify the duodenum and the ileum, but the duodenum is, really just somewhere in between. It does exist within a quadrant normally, but it's very hard to tell. Meanwhile, the duodenum is right after the stomach. The ileum is right before the large intestine. So those are a bit easier. Then we have the different sections of the large intestine. You have to know the haustra, the pockets along the way, the canicoli, the longitudinal muscle bands, as well as the rectum, the anus canal, anal canal as well. Then for accessory organs, we've got the pancreas with the pancreatic duct and the accessory duct. Those are listed on there. And then parts of the liver and the gallbladder, and then the various ducts that drain them. The cystic duct, the hepatic duct, and then of course the common bile duct. There's also a duodenal papilla that exists right here. It's better seen on the pancreas spleen model, which is on the stand, but that's where the bile as well as the pancreatic secretions dump into the duodenum. So these are just zoom up shots of that, of the head, going down to the stomach, where we can see our different areas. The sphincters we would point out at the areas just coming into the stomach, the upper esophageal or the lower esophageal or the cardiac sphincter, and then the pyloric sphincter through here. There's also, of course, the one between the ileum and the cecum, the ileocecal valve, that we can see right through here. Okay. We also have the digestive plaque, and as always with these plaques, like we saw with respiratory anatomy too, you got to know the large scale stuff, and you can see that through here like a 3D model. This is one of the few places that we can see some of the salivary glands, the parotid as well as the sublingual. If you want to see the submandibular one, look on the torso model. On the torso model, we can also see the parotid up by the masseter muscle, etc. But the submandibular you can see right underneath the jaw. We have a great view of the stomach with the different layers of the tunica muscularis, so you can actually see the longitudinal and the circular as well as the oblique. Okay, you see the rugae and then some of our different ducts leading down from the liver. The key aspect that I was talking about here, like with the respiratory plaque, is to make sure they focus on the zoomed up or magnified structures as well. This represents a plica circularis with the villi extending off of it. This represents an individual villus with the simple columnar epithelium with the lacteal going through the center of it as well as the capillaries. Some zoomed up versions or areas of that. This model here is a generic model looking at the wall of the intestine, and it really is a model that highlights well the 4 layers of the alimentary canal. So from here, the muscularis mucosae, up is the tunica muscularis. We have tunica mucosa. Then we have the submucosa through here. Then we have the 2 layers of the muscularis externa, or the tunica muscularis down here. And then we have the serosa way out here. So it's a good demonstrated model to show the 4 layers. The villi with the lacteals. This actually shows a Peyer's patch as well, which is indicative of the ileum. So, and then of course the muscularis mucosae. So I would say those are the things that you would want to see on this model. It doesn't have a T, but at least those 7 things are the basic things that they would need to see on it. This is from the chart. So I usually use the chart with this one as well, but there's a lot of things that we can see with this particular chart, but coming up as well, like the thorax and the lungs. There's a separate chart that we can see things as well. But this is pretty good. Again, shows the same thing like the 3D model, as the liver raised here, so you can see the different ductwork underneath it. This also is about the only place where you can see the greater omentum hanging down off the greater curvature of the stomach. So that's kind of interesting for them as well. This is about the only place where you can see the mesentery. Okay, the mesentery properly. So this is a shot of the torso model showing the same things, like the ileocecal valve coming in here, the cecum, haustra, the pancreas. Okay. This is a zoomed back version of the abdominal and thoracic cavities chart. This is the other one that we might use so that we can actually see respiratory structures and abdominal structures. So there is a separate digestive PROS chart, and then there's this abdominal and thoracic chart. So either one shows a lot of the structures that we would be interested in. Just a zoomed up version. It shows sequential cuts, coronal cuts getting into it. This is just a zoomed up area of the liver on the 3B model, but we also have the individual livers on a stick, like something you might get at the state fair. Now they'll look very similar to this, again with a cystic duct, with the hepatic duct coming into the common bile duct. But it also shows us, for instance, hepatic arteries. Hepatic veins would be blue, and then this is the hepatic portal vein, which is purple in terms of digestive function, coming from the intestine to the liver to bring nutrients for processing on its way back, the blood flow on its way back to the heart. So here is liver on a stick. Again, hepatic vein, hepatic portal vein, hepatic artery. This is the inferior vena cava, 2 lobes, as well as the tendon in the center. Just the other side of it. This is the pancreas, spleen, and duodenum model. And so obviously we would use it mainly for the pancreas and its 2 ducts, as well as the duodenum that we see here. You can actually see the common bile duct coming down, and the duodenal papilla is going to be right in here. If you zoom up on it, you might be able to see it a little bit better. In here, I believe. You'll see it on the model itself. But you can also see the circular folds of the plicae circularis as well. Another shot of it in the posterior side. Teeth. Teeth are obviously something that we cover in the digestive system as well. We've got a activity plaque like this where they need to do the individual parts of a tooth, the areas like the crown and the root, and then the neck through here, as well as the layers like the enamel and the dentin, and then the cementum like we see here. All of these are actually laid out in the lab manual, listed with their numbers, and there's a photographic representation of this model too. So they like this model. Shows the dentition as well. They'll need to identify the individual types of teeth, the medial and lateral incisors, the canines, the 2 premolars, and then the 3 molars, as well as the uvula and the rapine, etc. Okay, so this is part of the plaque. Again, just looking at parts of teeth and different types of teeth. Then we also have a couple other teeth type models. This is the teeth in the jaw. For this one, it would just be individual types of teeth. And then also layers have been into individual tooth. Okay? Then we have intact whole tooth models. So you need to know the different types of teeth, whether it's an incisor, a molar, etc. Likely we would do those where you can see the other teeth with them, but you can see the individual tooth types here. And then, of course, the different areas, the crown and the root and the neck, as well as the layers. Most of these teeth open up, so you can see inside of them. You can see like here. So you'd be able to see the root canal and the pulp cavity and things like that. Okay. So I think, while that's kind of a whirlwind, the different slides as well as the models and charts, I think that should cover everything that we would be seeing in the lab this week. Okay? So if you have questions about that, to be sure, you can refer them to the website. If you don't have it, let me know. And then past that, if you have individual questions, you can, of course, send me an email or whatever. We can try to meet during the week. Just let me know. All right.